शुरू करो। Hello everyone. Today I'll be talking to you regarding how to pass USMLE step 1 and step 2 in flying colors. Okay, well, people want to go to USA, and for that you have to pass USMLE. So many of you know something about USMLE. There are many people who do not know anything about USMLE. I will talk in such a way that I just presume that you are a fresher. Okay, so what is USMLE? It is United States Medical Licensing Exam. United States Medical Licensing Exam. This is a license that you need to work as a doctor in USA. It is mandatory for everyone, even if there is somebody who has done MBBS from USA, he is a citizen of USA, his mother and father are from USA, but still he has to pass MLE. Just like driving license, wherever you stay, you have to take a driving license before you drive. It's the same thing. This is a license to work in USA. It is a work permit in USA. It's not a degree. It means you are in India or any other country, you clear your MLE exam, you are getting a permit to work there. And of course, when we work, you get huge, very handsome salary. Very handsome salary you get it, and that's the star attraction for going for USMLE. What salary I'm going to discuss. And so it's not a degree, the point I told you. Now, how many steps are there in USMLE? There is step 1, step 2 CK, and there was step 2C also. But now they have removed it. It was a practical exam. For that you need to go to USA. But US government have removed this because they are in bad need of doctors. So they want more and more doctors should come to USA. That's why they have removed it, and they are left with only 2 step 1 and 2 CK, which I'll be causing as step 2. Even they have made this also easy. What easy I'm going to discuss in a couple of minutes. So what we learned so far, that you have to step 1 and step 2. Did you know MLE 1 and 2 are online exam? You need not go to USA. CS is abolished, which is a practical exam for which you need to go to USA, but as I told you, it's not there, so you don't need to go to USA. So that means you can do these 2 exams in your city if you are in a major city. And moreover, they have even step 1, they made it easy. Now it is pass-fail. In previously, there were marks. There were marks for this also. But now pass-fail, this had been changed from 26 January 2022. Why? They are again, as I told you, they are making more and more, they want more and more doctors should come to USA, so they are making it more easy. Now what we have for you, as I told you, we can do step 1 and step 2, we can prepare you. And as I told you, both are online exam, MCQ base. I'll talk a little bit more about later on. Okay, so we will train you for step 1 and step 2. Now what strategy we have for you? 3-round strategy planning for you to pass USMLE in flying colors. So 3-round strategy. What are these strategies? I tell you in detail, one by one. Round 1 is basic concept. Round 2 is test and discussion. Round 3, mock test with explanatory answers. Most of you commit the blunder mistake. You straight away jump to question, MCQ question. Senior says you do U-World question. U-World question. You are doing question, but you don't know the basic. That's the biggest reason of failure. So we start with basic concept, test and discussion and mock test. Let's learn more in detail. Round 1. I told you you should know the basic concept. Whether you are writing MRCP or MLE or Australian exam, whichever foreign exam you are writing, they want your basic concept should be very, very clear. If your basics are not clear, then there's no way you can pass this exam in flying colors. Okay? And moreover, there's nothing like subject. They don't talk anatomy, physiology. They talk about concept. Now I give you an example. I have a question for you. Look into this question. A 45-year diabetic hypertensive come to you in emergency with severe retrosternal pressing pain chest for last 3 hours. His pulse is 126, BP 130/80, cardiac enzymes are raised. ECG shows ST elevation V1 to V3. Now, this question will come in step 1. Same question will come in step 2. I'll be showing you the next slide. But in step 1, he will ask you which of the following artery is involved. Well, those of you who are medicos, just try to answer which artery involved in this. A, B, C, D, E. Okay, I'm leaving the slide for a couple of seconds more. So any one of you want to see, read the question again. It is there for kind reference. Okay, look into question very carefully. He's asking which of the following artery is involved. I hope by now you have marked the answer. Even if you are not writing, at least in the mind, A, B, C, D, E, 1, choose the answer. Now, same question will come in step 2 also. Looks exactly same question. But in step 2, is asking which is the best initial treatment for this patient. So again, answer are there: aspirin, angioplasty, CABG, metoprolol, or atorvastatin. Again, I give you few more seconds. Choose the right answer, whatever you can think of. Well, I'm sure by now you have written the answer of this also. Now, what you saw, question remains same in both, but only thing, this is a question from anatomy and this is a question from medicine. Well, just to inform you, answer this question is left anterior descending artery, V1, V2, V3. This is a anteroseptal. This supply anteroseptal area. There is a supply by left anterior descending artery. And this the best initial treatment is aspirin, is the antiplatelet drug. Okay, well, at the moment I am just doing webinar. But as I told you later on when I take test and discussion, again I'll come back, but at the moment I have to just be very brief regarding answer. But in test and discussion, I explain everything. I will answer why this answer, why not this. I'm going to explain everything when I discuss test and discussion. Well, important point. So unless you know the basic, you cannot solve the question. So whenever you start preparing for MLE, start preparing for together. 1 and 2 should prepare together. They don't ask a subject, rather a topic. I told you, the way I told you, they don't ask subject, they ask a topic. Doing question without knowing basic is the biggest mistake of students. I told you the previous slide also. Straight away go to question bank, you don't know anything. So basic should be very strong. And that's the main cause of failure is not knowing the basics, straight away going to questions. Now what solution is there? We understood the problem, okay? So it is good to know how to get success. It is good to know how to get success, but better to know how not to fail. Don't do the blunder mistake, okay? And don't forget, step 1 exam fees is rupees 1 lakh. Step 2 exam fees, rupees 1 lakh. So expensive. And if you do not clear the exam, it's all a waste of money. Now, what we have for you? So we have a round 1. In round 1, we'll have 350 hours of pre-recorded lectures of whole USMLE Step 1 and Step 2 syllabus. It will clear your basic concept. You don't need to read any other book. Complete lectures detail. Okay, now you are saturated with the basic concept. Okay, your basic concept. So now, from where the content has been created. What book you read? First aid, step 1, step 2, UWorld, Kaplan Note, Master the Board series, Becker Note, Golzan, Prathoma, Robbins, Harrison, Ganong are the things from which content has been imbibed and ultimately this content has been created. So you don't need to read anything else. You read any book. People read First Aid. They say, very good book, beyond doubt. But it is too scattered. The anatomy at one place, physio at other place, pharma at one place. Everything has been gathered at one place in my lectures. Second round, 700 topic-wise test and discussion. The way I gave you question. I gave you 2 questions. Okay, so you will do the question. Then I'll discuss, and of course, every question I'll discuss at least 15 to 20 minutes, detailed discussion. I'll be taking why, like in first question, why LED is the right answer, why not other discuss. I'll discuss in detail. In second question, why aspirin is the best drug, why not other, again in detail, so that you know, oh, what mistake I did. Oh, I answered metoprolol, but answer aspirin. I'll give you answer why aspirin, why not metoprolol. And that is test. And if you know this much, you are the boss. And all the questions are based on UWorld and BE First Aid. Okay, depending, because these are questions. So you will be getting similar type of question what will be asked to you in your USMLE exam. One thing you got to know, basic concept what I discussed just now, they are same, whether Indian exam or MLE, MRCP, Australian exam, Gulf exam, basic concept remain same, they don't change. Difference lies in the question pattern. Question pattern. What I mean to say, well, rice is eaten by in every part of the world, but cooking method is different. In the Punjab, rice is made in a different way. If you go to Eastern India, in Assam, they made a different type of rice. You go to South India, they make a different type of rice. Rice is rice, but pattern of preparation is different. Same with tea also. You take tea in different ways, somebody else take it in different way, tea remains same. Exactly same thing with basic concept remains same, difference lies in the different type of question. MRCP pattern are question different, MLE is different, and Indian PG is different, that you know very well. But these I'll be taking question based on USMLE. And when I teach for MRCP, we take question from MRCP pattern questions are taken. Third, once you are through with the basic concept, once you are through with the test and discussion, now come the full test result. 20 full syllabus mock test will be given to you, and that we give written explanatory answer also. Again, that means if you must have done wrong, any by mistake you do anything wrong, you can read the explanation, and this is complete. And after that, you can do for practice, you can do UWorld question. They are the ultimate question of the UWorld. You don't need to read anything else. Okay. More than 90% of the question of your USMLE step 1, 2 will come from the content which I'll teach you. If you know 90%, you are the top ranker in USMLE exam. Additional advantage, doubt clearing portal. Nobody gives you, you are studying, you have certain doubt. What to do? You can very well ask me. So we give a platform to clear your doubts. It's a beautiful platform. We answer question immediately. Personalized mentoring, okay, I do personalized mentoring on day-to-day basis if you want. Now, problem is, sir, I feel very sleepy and tired while studying. I study a lot, but I tend to forget. There's always a cloudiness in my mind. Which book, question bank should I read? Again, big confusion. How to study efficiently? How to manage time efficiently? How to study with such a heavy duties if you are working somewhere. So all these I'll give you an introductory lecture also. In that I'll tell you how to study all this thing. If you do the thing the way I told you, you will applying the flying colors, rainbow. We can guide you, study has to be done by you. It's not the speed we determine the destination, but the right direction. I'm here to give you the right direction. Do it. Do it. Right direction, USP, unique product in the world. All at one place, question bank, notes, test and discussion, nobody else is doing like this. You don't need to read anything else. Biggest advantage, you don't need to read everything I'm giving to you. Plus, I'll give you a copy of my mini Harrison also. We'll be giving mini Harrison, ultimate book, best-selling book in the Amazon also. No other institute is giving these services, lecture, T&D, doubt clearing, platform, personalized mentoring. Nobody does it. Okay, you see anything? Do they give this type of service? No way. Now, frequently asked question. When should I start preparing for USMLE Step 1? Undergraduate day or from today? Time is money. In India, the biggest problem is we waste time for no good reason. We want to do USMLE, but okay, people come to me, sir, I want to join USMLE. Fine. Okay, they will take, okay, I'll take to my uncle, auntie, blah, blah, and they waste one more month. No. First of all, if you want to go for MLE, MRCP or all top rank exam, time is money. Don't waste time. Wasting time is absolutely contraindicated. What a time to write the exam? Step 1, 6 months, within 6 months of, within first 6 months of internship. And step 2, soon after internship, and the clinical rotation should be done at the second half of the internship. But sir, my senior says you should prepare in second year, write step 1 in third year. Biggest mistake. But my seniors say, then my answer is I am senior to your senior also. Remember, even if you clear your step 1 in third year, you cannot go to USA till you have done your internship. And now your knowledge in internship is far better than in third year. Those of my colleagues who are in final year or internship, they will agree with me. Okay, remember, they ask clinical-based question. In third year, you have not seen any clinical cases. So don't commit this blunder mistake. Okay? It should be never be taken in third year, fourth year MBBS. Do in internship or later on. What the right score for surgical or clinical branches? People say you don't get surgical branches. Again, wrong. If you have good marks, you will get any branch. Now, step 1 is pass-fail. I told previously, before 26 January 2022, it used to be marked. But now they have made it easy. For step 2, you should have 250 plus mark. Then only you get good college, good university, and with good branches. How USMLE preparation for MLE, next PLAB or AMC exam? Yes, 90% of the syllabus is same. The only difference lies in the type of question, which I told you. Basic concept remain the same. So, my teaching will help you in grade to get top rank in next exam also. I teach a concept. Maybe I have taught you entire, maybe urinary bladder or maybe cerebellum or any topic. I teach A to Z, including anatomy, physio, patho, pharma, whatever you. Once you have seen the topic, then you do MCQs of that topic from question in Indian PG, anatomy, physio. That means your one topic is finished. That is the one. So it is going to help you in your NEET exam also. So student, we make you ready for Indian as well as international exam also. Exam format of it is a consist of MCQs, all clinical based question. Is short reference I gave you in that this also. When does exam occurs? Monday to Friday daily. Not known to 90% people don't know. Not like Indian exam which happen once a year only. You can write any day. You prepare, you apply, you get a seat, you get a proper center. So except Saturday, Sunday and guest holiday, you can write exam any day. The biggest advantage. Repeating second time, biggest advantage. They ask topic, not subject. They want integrated study the way I give you sample. I start now even integrated study. I started my institute 25 years back for PG enters. The integrated approach I started 25 years, which National Medical Council or Indian government started now. So I have the huge experience. Till date, I have taught more than 300,000 students. That is 3 lakh students. So I know what the integrated approach is. Okay, huge experience. There is no other faculty in the whole world who has this much experience in teaching students. Now let me give you a comparative of Indian and USMLE. This is an entrance exam. Indian PG, no. In entrance exam, you should know what others know. It's a game of musical chair. Okay, even if you are a good student, but and moreover 2 lakhs people write this Indian PG exam. If you want a good rank, you have to be among the first 5,000. Dharma, radio, medicine, surgery, pedia, 2 lakhs people, 5,000. Even if you are getting 5001 rank, you may not get a good college. Although you are a very good student, but not like this. You have to beat yourself. Okay. Number of times, once, daily, Monday to Friday, very easy. Whenever you are ready, you take exam. International value, less, much more. Definitely when you are in USA, you will go for higher studies, then the value is much more. Cost, yes, it's a costly exam. 30 to 40 lakhs are needed. Okay, or if you talk about dollars. But annual salary is again, even when you enter, this much salary you start getting on day one. That means whatever expenses you are doing, you can recover in 6 months time only. And I don't think I need to tell you the salary of India. Okay, it is very discouraging, disappointing. Now we also, in addition to that, we help you for roadmap for MLE. So what is the roadmap for MLE? You pass step 1, step 2 with flying colors. We will train you. Once you pass, then you have to go for ECFMG certificate needed. It's just like you pass your MBBS, you go to State Council for registration, and then only you can start internship. The ECFMG certificate is needed, but that is all online. We will guide you. You have to pass English exam, but it's a very easy exam. You can pass before writing your MLE step 1, step 2 also. Why I say it's an easy exam? Because we Indians have a good English. This problem lies in those who are from China, Thailand or other countries or Vietnam where they don't speak much English. So they have a difficulty, but for us, we have a good English. We have been taught in English, so we don't find any difficulty, but it's a mandate to pass English exam. It's very easy for Indian. So once you have done with exam, ECFMG certification, English, then you have to go for ERS, Electronic Residency Application Service. You have to apply for residency. For that, you need, in addition to that, filling this ERS, you need US clinical experience, clinical rotation, what they call as. It can be done face-to-face, better if you have, but for that you have to go to USA for 3 months, it's very costly. But during the COVID time, because people know that US people know that doctors cannot come to USA, they started telerotation on telephone also. Nowadays also they are doing it, but this is much better, but very costly. You have to stay in USA for 3 months. That is very expensive. And telerotation can be done in India also. Research experience is needed. This again carry a lot of weightage. We'll guide you for that also. Definitely will help you in getting your research experience. And once you that, then you get letter of recommendation, carry from the US faculty. Again, we'll assist you for all these things. But these are additional points. These two are very, very important. But remember, first are marked, then they are the all additional thing that you need. We'll help you for that also. Now, application should reach USA before 31st August every year. ERS opening start in 1st to 15th September of every year. And then you wait for an interview call. It means by 31st July, you have to clear your step 1, step 2, and you need about 1 month to fill the form also, application form also. 1st October to 28th Feb is the interview season. You have to go again to USA. That means you first went for rotation, again you go for interview. But sometimes this can be done in India also on telephone, depending on the university. But face-to-face carry definitely a better impact. Again, additional expenses, again staying for a couple of months, very expensive. Residency starts from 1st July every year. It means, suppose you are applying you fill the next year form. Let's say you are in 23. You have 2023. You have to clear your MLE exam by 31st July. You fill the application in August, and August 2023. You will be able to join, even everything goes smooth, or you can join in 2024. So it's a long procedure. Okay. We'll guide you for all this, but we'll train you mainly for 1 and 2. Very clear about it. But for every other thing, we give assistance. We have colleagues who are doing all this thing. We'll guide you, and the best thing we will be doing for you, and we'll be doing mentoring. As far as these are concerned, we'll do day-to-day mentoring. I've also written the book Medicine Simplified. Is a mini Harrison, ultimate book. Harrison is the ultimate book of medicine. But Harrison is a very vast book. It takes half an hour to read one page of Harrison. You need 2 hours to understand what is written, but you need only 2 minutes to forget what is written in Harrison. So I have come with a mini Harrison. Mini Harrison, you read this much, you don't need to read any other book. Okay. So also I have smart medicine lecture for those undergraduate students who want to read medicine. They're recorded lectures, the best medicine lecture in the world. I can challenge on this point also. So for any queries, you can very well contact me. Okay, you can take a click. I'll leave this, or maybe only one more slide is left. Again, I'll come back. I'll leave this slide. You can note it down, or you can take a click right now also. So for any query, WhatsApp, you can mail me or you can WhatsApp me. We'll be helping you. We are there to help you, to guide you at every step of your journey to USA. I hope by now you must have written it. So thank you very much. But again, I leave it for a few more seconds so that you can see, you can note it down for those who are not able to write. Best is to take the click. So any query, you are more than welcome to ask me. God bless you. Thank you very much for joining the session.